Now we're scanning the right testis. When we focus the right testis, the texture of testis shows heterogeneous texture, slightly echogenic texture, which occur in inflammation. The normal testis shows homogeneous, less echogenic texture. When there is inflammation or infection in the testis, the blood flow in the testis will be also increased. So color Doppler will help us to differentiate whether there is inflammation or not in acute condition. Here we see the increased flow in the testis. When there is no inflammation, minimal flow will be observed. In all slides of the testis, we see the blood flow. Here we see the increased flow in the tympaniform plexus. This is epididymis, which also shows heterogeneous texture and increased echogenicity. Normally, its texture is also less echogenic. This is spermatic cord, which also shows increased echogenicity and increase in size. The size and texture of spermatic cord is increased in inflammation. Here we see free fluid around the epididymis. The scrotal skin also shows heterogeneous texture and mildly increase in size or thickened. Now we will continue scanning the inguinal canal by tracking the spermatic cord to the right inguinal area. Here we see the hypoechoic or anechoic area in the inguinal canal. Now we continue scanning the inguinal canal. It becomes narrow and continues to the pelvis. Here we see the free fluid or ascites in the pelvis. These are gut loops which are floating in the fluid. Peristalsis in the gut loops are also present. Here we see the lymph nodes which are increased in size with preserved central fatty hilum in the inguinal area. The patient is also feeling pain at this area due to inflammation. Here we see the inguinal defect at inguinal canal. The fluid is penetrating from this defect to the inguinal canal. Now we will measuring the inguinal defect. The defect size is 7.2 millimeter, measuring from anterior to posterior. This is left testis. It also shows heterogeneous texture, less echogenic to echogenic texture. On color Doppler, we also see increased flow in the testis due to inflammation. Here we see the calcified area around the testis and epididymis due to chronic inflammation. In all parts of the testis, we see increased blood flow. The epididymis is also increased in size and shows mildly increased echogenicity. Here we see the body and tail of epididymis, which is prominent or increased in size due to inflammation. Now we scanning the spermatic cord. It also shows increased echogenicity and increase in size. The proximal part of spermatic cord is more inflamed as compared to the middle part and increase in size. Here we see the Debney's fluid or collection in the scrotal sac. Now how we will write report.